Yes, it is. New Jersey.
Well, first of all, let me thank you, my colleague from California, and each of the other speakers here for the contribution they've made tonight, and particularly when I listened to my colleague from Tennessee talk about those particular cases of individuals that were impacted, because that's really what this is all about. It's again, it is amazing to me that the first act of this new Republican majority is to try to repeal a bill, or the health care reform, that really is making a difference for people on a personal level, particularly with the patient protections. And, you know, I thought to myself when I was coming down here, who benefits from repeal? Who could possibly benefit from repeal? Because as many of you have talked about all the people who are going to be harmed by it, who would benefit from it? And the only group I could think of that would benefit from the repeal are the big insurance companies. Because if you think about it, what do they want to do? They want to keep increasing premiums. I read that in your state, I don't know, you may have already mentioned it, Blue Cross, Blue Shield, whatever, is talking about a 50-something% increase. It was unfathomable, these double-digit increases. And, you know, we, of course, as this health care reform kicks in, it's going to be more and more difficult for the types of increases that we've seen in premiums that these big health insurance companies have put forward. And the reason they want to get rid of the insurance companies want to get rid of the Patient's Bill of Rights and reinstitute all these discriminatory practices, whether it be, you know, denying care because of pre-existing conditions, or reinstituting lifetime caps, or, you know, the different protections that we've seen kick in. The reason they want to do that is also money oriented. In other words, you know, they have to pay out money. You talked about the cancer person. I was up at the Rules Committee earlier, and Mrs. Slaughter was talking about someone who had cancer and was treated and ran into the lifetime cap, and then the cancer reoccurred, and there wasn't, and she didn't have any more coverage because she had hit the lifetime cap. And that's a perfect example. They want to have lifetime caps, they want to have annual caps, they don't want pre-existing conditions, they don't want your kids on your policy, because it saves them money. That's the way that they make profit and pay dividends to their shareholders, is by raising premiums and having discriminatory practices that eliminate the people that cost money because they need health care. I mean, it's that simple. And already, just in the last few weeks, provisions have kicked in that go against that. We had the President announced, or the White House announced, I think, around Christmas time, new regulations that say that any premium increase that's over 10% will be scrutinized, and they will, you know, try to, under the provisions of this bill and new regulations, to not allow those increases to go above 10%. January 1st, the provisions kicked in that said that 80% of your premium costs had to be used for benefits, couldn't be used for insurance company profits, couldn't be used you know, to pay back dividends to the shareholders. So all of these initiatives that are already kicking in, they basically make it more difficult for the insurance companies to make a big profit, and the consequence of that is that health insurance becomes more affordable. Now, the other thing that I was up at the Rules Committee earlier, and it was interesting because I think you mentioned, my colleague from California, that, or one of you mentioned, that we, under this bill, under the health care reform that's in place now that they want to repeal, we get the same health insurance as congressmen as any other American. And, you know, I still have people write to me and say, well, you have your own policy, but you want to give me this, you know, lousy coverage that I'm going to get under the health care reform. And I have to write back and say, no, that's not true. You know, you may hear that on some TV station or something, but it's simply not true. We specifically wrote into the bill that we have to go into the exchanges just like everybody else. We're going to be different from other federal employees as congressmen because we go into the exchanges. And so at the Rules Committee today, one of the members, one of the Republican members who is very supportive of repeal, said that he specifically wasn't going to take you know, health insurance as a congressman, and he wanted me to know that because he was voting for repeal. And, you know, I said, well, that's very nice and that's commendable for you, but I frankly think that every member of Congress who votes for repeal should say, I don't want health insurance through the federal government. Because if you're going to deny it to everyone else, you should deny it to yourself, just the way, we're saying that we're going to get the same coverage as everyone else. Well, if you don't want anyone else to have the coverage, then you shouldn't get it yourself. And I know that some members have already taken issue. There was one member from Maryland who came to the orientation, a Republican member from Maryland, who apparently was a big advocate for repeal. And he said that he was inquiring because his federal health insurance didn't take effect as a congressman until February 1st. We were sworn in yesterday, but I guess it takes 30 days before the insurance actually kicks in. He was complaining about the fact that he had to wait till February 1st to get his health insurance as a congressman. Well, again, if you're going to vote for repeal next week, you shouldn't be worried about when it's going to kick in. You shouldn't be taking it at all, in my opinion. So, there's a lot of, there's, I don't know what the word, smoke and mirrors or whatever the word is that going on around here on the other side of the aisle in how they're viewing this. And my point is, there's a lot of protection here for people. Don't deny them that unless you're going to deny it to yourself. But more than that, think about who's helped by this repeal. Only the big insurance companies. They're the only ones that are going to benefit. I know you were the insurance commissioner, and so you know exactly what I'm talking about. I yield back.